Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with Nassau Community College student Gina Peter. And today we're going to talk about gynecological cancers and women's health.
Our guest today is Dr. Carol Brown, a gynecologic surgeon and Chief Health Equity Officer at Memorial Sloan Kettering Cancer Center. For more than 2 decades, Dr. Brown provides care to women with ovarian, uterine, cervical, and vulvar cancer.
So I've also learned about Dr. Brown has focused her career on reduction and elimination of cancer health disparities experienced by medically underserved populations. And she is their first Chief Health Equity Officer. Dr. Brown, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much. Thank you, Jeanine, and thank you, Gina. I'm very happy to be here today.
So congratulations on being the first Chief Health Equity Officer. What does someone in that position do, and what does it mean to you to be that first person in that role?
Thank you so much. Well, it's actually a new role, really, not just for Sloan Kettering, but it's a new role in healthcare in general. There are many businesses, I think, that have started to have had chief diversity officers. But the issue of equity is really a relatively new term. And I've been actually working in this space for over 15 years, dealing with the issues of cancer health disparities, particularly as they affect people who are facing socioeconomic challenges and people of color. But what we wanted to do was really turn the focus away from just describing the disparities and the differences and actually focusing on the outcome, the desired outcome, which is to make sure that all people with cancer, no matter what their challenge, are getting the best possible outcome, survival, cure, and survivorship from their cancer. So equity really means that not only does everyone have the same ability to reach that great outcome of surviving and thriving after their cancer diagnosis, but that we take into account whatever might be the inherent challenges that that person has, whether it be their race, their ethnicity, their socioeconomic status, their physical ability, that might impact their ability to have a great cancer outcome. And we give them the tools and the support that they need in order to have that great cancer outcome. So that's really the difference between equity and just talking about diversity or just talking about equality. Equity means we are actively doing something to make sure that everyone gets a great outcome from their cancer. So that's really what being the Chief Health Equity Officer is about. It means that at Sloan Kettering, I'm responsible for working with all of my incredible colleagues and across the institution to develop initiatives and programs and research that will both address and eliminate cancer disparities, but most importantly, give all of our patients cancer health equity.
Let me just ask you, are people of color more predisposed to cancers, particularly gynecological cancers?
So, yes. In short answer, yes. If you look at, even though in the last 10 years there have been some incredible advances in terms of cancer, in terms of lower death rates and increased survival, Black people in the United States still have both the overall highest incidence, meaning the highest number of people per 100,000 population, as well as the highest death rates from cancer of any other racial or ethnic group. And this is particularly true for Black men with lung cancer and prostate cancer and colon cancer, and Black women with certain types of breast cancer and colon cancer, and one of the cancers, GYN cancers that I deal with, which is endometrial cancer. So unfortunately, Black women in the United States have a 20% lower 5-year survival from endometrial cancer compared to white women. This has been true for many decades and hasn't changed. So this is an area where I personally, and Sloan Kettering specifically, and also many of my colleagues at other cancer institutions around the country are focusing on to try to get rid of this disparity and understand why Black women suffer more from endometrial cancer.
Have they ever been able to isolate why Black women are more predisposed to gynecological cancers?
Well, specifically for endometrial cancer, we've seen some interesting observations over the last 4 or 5 years. And this really applies to every woman in the United States. Endometrial cancer is very common. It's the second most common cancer that women get after breast cancer. And endometrial cancer is now about the 5th leading cause of cancer death in the United States. And that's because endometrial cancer has been increasing for all women very rapidly. We think we are in the middle of an epidemic of endometrial cancer. It's starting to affect women at much younger ages than it did a decade ago. It's starting to affect women who are still getting their periods, who are in their mid and late 40s. And it is affecting women who don't have the typical risk factors that I was taught about in medical school of being very overweight, of being very old, being in their 70s and so on. We're seeing this cancer in what I would consider relatively young women who are of normal weight, and we really don't understand why they're getting this cancer. Black women, one of the reasons Black women are more at risk is that some of the symptoms of uterine cancer, the main symptom is abnormal bleeding. And we know there's been a lot of research done about abnormal bleeding and things like fibroids in Black women, and whether it's an issue of Black women themselves kind of being used to being told that, oh, it's nothing, you're bleeding, that's okay, just, it's part of your normal cycle. Or whether it's that when Black women bring these symptoms to the attention of their physicians or the healthcare system as part of historical racism, really, and images and, the whole theory that, for example, Black women are more tolerant to pain. Some of these things are very well researched and discussed that can really affect the symptomatology. And one of the things that we want to do is make sure that Black women especially know that when they're over 40 and they have abnormal bleeding, a heavy period or spotting in between periods, if they have a history of fibroids and they're having abnormal bleeding, that they really bring it to the attention of their healthcare provider and ask the question about, could this be endometrial cancer? So that's one of the things. The other issue is that Black women tend to get more aggressive types of endometrial cancer. There are different types, but Black women tend to be more likely to get what's called a type 2 cancer. That's more likely to have spread beyond the uterus or more likely to come back. So that's another important message because Black women need to know that, their doctors need to know that, and we want them to be aware of the most important treatments, including new treatments for endometrial cancer.
So what are some of the ways to reduce cancer disparities?
So a great example of how you can reduce cancer disparities is the story of breast and cervical cancer in the United States and what actually the federal government and former President Bill Clinton did and the CDC did now almost 30 years ago. So 30 years ago, when I was graduating from medical school, Black women had much higher rates of death from breast cancer and cervical cancer, and much, much lower rates of being screened for those two cancers. So screening for breast cancer is a mammogram, and screening for the cervical cancer is a Pap test. And both breast cancer and cervical cancer are highly curable because there's a screening test for both of them. So what the federal government did and the Centers for Disease Control did many years ago is they developed a federal program administered by the Centers for Disease Control called the Breast and Cervical Cancer Early Detection Program. And this was a federally funded program that provided free mammograms and free pap smears and was made particularly available in areas of the country, including what's called the Black Belt in southern United States, where very high rates of cervical and breast cancer existed because a lot of Black women live in the South. And we then saw 10 years later, 20 years later, that the difference in survival markedly disappeared and the difference in screening rates completely disappeared. So now, if you look at the available data, Black women are just as likely or more likely to be screened for breast cancer and cervical cancer than other groups because of this program. So access, that is one way. Increasing and helping with access to screening is a very effective way to get rid of disparities. Right now, an important message is that colorectal cancer, which I'm sure many of your listeners are aware that colorectal cancer has taken many prominent Black people from us. Most recently, I think everyone is aware that Chadwick Boseman passed at a very young age from colorectal cancer. There is screening for colorectal cancer, and Black people need to know that they need to get screened, and they need to get screened at an earlier age than white people. Their groups now are saying Black people should get screened even beginning at age 40 for colon cancer. Wow. So that screening and access to screening and prevention are great ways to get rid of cancer disparities. Another way, though, is getting the right treatment and access to cutting edge treatment and clinical trials when you've been diagnosed with cancer. It's about getting access to the right type of specialist. It's about getting access to what we call multidisciplinary care for your cancer. Cancer is not something that you just deal with just surgery or just radiation. You really want to have, when you have a cancer diagnosis, you want to have the benefit of having a whole group of people who have different tools and ways to help you. And that's the kind of multidisciplinary approach that's very important for somebody who's been diagnosed with cancer to get. So getting access to screening and prevention and access to care and access to clinical trials are great ways to eliminate cancer disparities.
So when you're talking about screening, give me, for example, some simple screening that I would do on an annual basis or get in general. When do I start having a PAP done? And I know it is annual, but how early?
PAP tests now. We've had a real revolution in cervical cancer because we know that human papillomavirus causes cervical cancer, as well as many other types of head and neck cancer and anal cancer. So PAP tests now actually are not done every year because we can combine, and most PAP tests now also test for human papillomavirus and test for the type of HPV that causes cervical cancer. Women can now increase or decrease the frequency with which they need to get pap smears. They should start at age 21, and they should be done when combined with the HPV testing every 3 years. If you do HPV testing alone, you can have it even longer intervals. What is important for a woman to do every year is to see her gynecologist and have a pelvic exam, even though she doesn't need a pap smear every year. But pap smears are very, very important to get done and very important to continue throughout your life, particularly as long as you're sexually active. So even though some of the recommendations say that, over 65, you don't need to have a pap smear anymore, well, a lot of that is based on the old days when, for some reason, they felt that women over 65 didn't have sex anymore. What message that we try to give people is that if you are continuing to be sexually active into your golden years, as we call them, you should continue to have screening for pap smear for cervical cancer. Another really important screening test for women is obviously mammography, and that should be done every year, beginning at age 40. Now, there's a lot of controversy about doing it every year, every other year, but we tell people every year. and that's a great screening test for breast cancer. The third important screening test for the audience to know about is colon cancer screening. And the best way to screen for colon cancer is a colonoscopy, which is a procedure that only has to be done actually every 10 years if it's normal. But there are other methods of screening. There's a way to test your stool, not for blood, but to test your stool for the actual cancer cells that can be in your stool if you have a colon cancer. And that's a test that your doctor can make available to you. So there's some really good screening tests for colon cancer. And I think colon cancer is one that people don't think about, but particularly young people. If you have colon cancer in your family, if you have a Chadwick Boseman in your family, you need to talk to your doctor about getting a colonoscopy, even if you're 30, even if you're 25. Because if it runs in your family, then it may mean that you need to start getting screened much earlier.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College student Gina Peter. And today we're learning about gynecological cancers and women's health with our guest, Dr. Carol Brown, a gynecologic surgeon and the first ever Chief Health Equity Officer at Memorial Sloan Kettering Cancer Center. We just want to know, what about and how does breast self-examination fall in there with the self-screening?
So it actually has never been proven in a trial, like in an experiment, that breast self-exam reduces the death rates from breast cancer. So breast self-exam should not really be recommended as a screening test. It used to be, before mammogram became so available and so on, that your doctor would encourage you, say that it's part of your breast cancer screening. However, I think breast self-exam is very important. I think that women should perform breast self-exam periodically, once a month, once every couple of months, because there are some types of breast cancer that are not the most common, but some of the ones that Black women get may be missed on a mammogram or can develop so rapidly that they might present as a lump. So I do encourage women to do breast self-exam, but it is very, very important that women do not think that breast self-exam is screening. I just saw a patient today when I asked her why she hadn't gotten her mammogram. She said, well, I'm doing breast self-exam. And I had to explain to her that it's not a screening test. So your fingers are not as sensitive as a mammogram, and you need to get your mammograms. But if you find something, honestly, anywhere in your body, as gynecologists, we encourage women to examine their breasts. We encourage them to examine their genitals with a mirror. And if they see something that looks different, get to your provider, point it out, get it biopsied. It's very, very important to know your own body. Knowledge is power. So I do support breast self-exam as long as we know that it's kind of an adjunct to screening. It doesn't replace screening with mammogram.
So what are some other early warning signs that a woman might feel or notice if they may have a gynecologic cancer?
So I think bleeding is a really, really important one. And again, we're focusing on endometrial cancer, which is the most common GYN cancer. And again, as I mentioned, it's an epidemic. But I think bleeding is important. And women know their own bodies. They know what their cycles are like. They know the pattern of bleeding. So if you notice abnormal bleeding, and I will caution that this is really for women who are at least 40 or in their mid-40s, that you do need to be concerned, particularly if you're Black, that this could be a sign of endometrial cancer, meaning that if you have a period that's heavier than usual, bleeding in between your periods, spotting, brown discharge, I think everyone knows, or they should know, that once you've stopped getting your periods and you're in menopause, then any bleeding, any spotting, any discharge is a warning sign. And you need to bring that to the attention immediately of your provider and get a biopsy done. So bleeding is a very common sign, abnormal bleeding, a change in the pattern of bleeding of both endometrial cancer, and it can be a sign of other GYN cancers like ovary cancer or cervical cancer as well.
So talk to me about is there a connection between, we talked about a higher incidence of Blacks with cancer, Black women with gynecological cancers. Tell me, is there a connection with the nutrition, our diets, what we eat, and our predisposition for gynecological cancers?
I think that we don't know the answer to that. We do know that there is a link between diet and colon cancer and diet and breast cancer. And since most types of endometrial cancer are associated with some hormonal issues and excess estrogen, I do think that our diet probably does play a role. I think our diet, certainly for colon cancer and breast cancer, high fat diets have been shown to absolutely, particularly with colon cancer, because what you put in your gut is actually being directly exposed to the lining of the gut and the cells that can become cancerous. So fatty processed foods are definitely associated with colon cancer. In terms of things like endometrial and breast cancer, it may not be so much the fat content, but it could also be the issues of hormones and antibiotics and things that are added to food that we eat. So we don't know the answer to this yet, but there's a lot of theories out there that one of the reasons we're seeing this marked increase in the number of cases of endometrial cancer has to do with hormones and antibiotics that have been added to the meat, chicken that we eat and that we ate as young women and as children, increasing our exposure to estrogen. We don't know that yet. What I tell everyone, there's no question that in order to help prevent cancers, particularly colon cancer, breast, uterine cancer, and prostate cancer, following a low-fat diet that is, when I say natural food, I think you want to just think about there being the least steps of processing between that food occurring in nature, even if it's meat or fish or chicken, and when it gets into your gut, right? So it's better, even though it's not as convenient, it's better to get, some broccoli yourself and steam it than it is to eat frozen broccoli. You know what I mean? That has preservatives add to it. Just things like that. It's better for you to get chicken that doesn't have a lot of hormones and it's quote unquote organic and fry it yourself, even if you're going to put a whole bunch of salt on top of it, than to get chicken from a fast food place. Yeah. That's the kind of thing you want to think about. And vegetables are very important. It's been clearly shown, the benefits of plant-based diets on your blood pressure, on diabetes, but it definitely has a benefit. And not meaning that you can't eat meat at all, but the more plants you eat, the more green things you eat, the more you're going to get naturally occurring vitamins and substances like antioxidants that help your immune system fight off cancer and help you with other chronic diseases like diabetes and high blood pressure. So diet is very, very important for people in terms of things they can do to prevent cancer.
How can institutions like Memorial Sloan Kettering increase enrollment in cancer clinical studies, trials?
Thank you for that question. So that's another big area that I've been focusing on for many, many years. And I tell audiences, and I'm speaking very often specifically to people of color and to Black people about cancer clinical trials. And it's understandable that we as a community are mistrustful of science and mistrustful of healthcare systems because of the terrible history of racism, institutional, structural racism in the healthcare system that goes way, way back. And so it's understandable. However, the message I bring is that the issues with cancer and with scientific research in general have really evolved, and you don't have to be concerned that you are going to be a guinea pig or that someone is going to be experimenting on you for no reason when you're talking about a cancer clinical trial. Cancer clinical trials, the reason you should participate and should always ask, if you've got a cancer diagnosis, you should always ask your oncologist, am I eligible for any clinical trials? The reason being that in a clinical trial for cancer, you're not going to get a placebo. You're going to get the best known possible treatment. And very often they're going to be adding something that's cutting edge, that's even more suspected to be even better to that standard great treatment. You're going to be getting watched very closely. You're going to have more than the usual number of interactions and appointments and being followed by nurses and doctors and therapists. And very importantly, remember I mentioned earlier, it's about access. Participating in a cancer clinical trial is one of the best ways to get access to new exciting treatments before they become available to you via the general public, and often before there can be barriers put into place by your insurance company in terms of, for example, not wanting you to get a drug because it's so expensive. So cancer clinical trials are a great way to reduce cancer disparities, and I tell every cancer patient you should ask about clinical trials.
What is the one thing you want to leave our audience with when it comes to gynecological cancers?
The one thing I want to leave the audience with in terms of GYN cancer, and particularly for women of color, is that knowledge is power. I want you to know that Black women and women of color are at a higher risk of dying from endometrial cancer, and that this is preventable. I want them to know that if they have the symptoms of abnormal bleeding, that they need to bring it to the attention of their healthcare provider and get an endometrial biopsy. And I want them to know that if they've been diagnosed with endometrial cancer or GYN cancer, that they should definitely get access to a gynecologic oncologist, a multidisciplinary approach like the one that we have at Sloan Kettering.
Dr. Brown, how can we get in touch with you for more information?
In terms of people that are interested in getting more information or interested in getting more information about cancer in general and our programs at Sloan Kettering, we have an incredible website, mskcc.org, where you can find out just information about cancers in general. You can put in what type of symptoms you're having. You can find out about clinical trials. You can also make appointments online. And then our phone number is 1-800-525-2225 to make an appointment or get more information from Sloan Kettering.
Well, thank you for being here, Dr. Carol Brown, a gynecologic surgeon and the first ever Chief Health Equity Officer at Memorial Sloan Kettering Cancer Center. We hope you stay safe and continue to do the great work that you're doing. And thank you for being our guest today.
Thank you so much.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.